The Occupational Health Program is a vital part of public health that focuses on ensuring that every Filipino worker stays safe, healthy, and productive. Occupational health is all about promoting and maintaining workers' physical, mental, and social well being. It is not just only preventing accidents, it is creating environments where workers can work safely, efficiently, and with dignity. The program ensures safe work environments to prevent injuries, illnesses, and deaths. In our country, workers in industries such as agriculture, construction, and manufacturing often face risks due to exposure to noise, chemicals, or heavy workloads. This program aligns with the DOH and DOLE collaboration, a partnership that is meant to protect workers and improve productivity through preventive health measures. The Occupational Health Program is guided by the Occupational Safety and Health Standards, or OSH or OSHS, and the DOLE Department Order number 198-18, which details safety measures for all types of workplaces. It also supports RA 11058 or the Occupational Safety and Health Law. This law strengthens compliance with safety standards and imposes penalties for violations. Most importantly, this framework encourages shared responsibility, meaning employers, workers, and government agencies work together for the benefit of the employees. That means employers must provide safe facilities, workers must follow safety rules, and government agencies must enforce policies. The Occupational Health Program is aimed to prevent and control occupational diseases and work related injuries. For instance, preventing back pain through ergonomic interventions or reducing chemical exposure through proper ventilation. Second is to promote health, safety, and well being of workers in all employment sectors, be it formal or informal. Every worker, from office employees to field laborers, deserve equal protection. This program is also aimed to ensure access to quality occupational health services across industries. This includes medical exams, safety trainings, and preventive programs provided by qualified occupational health personnel. The first principle that this program stands on is the prevention as the most effective strategy. Rather than waiting for illness or injury, this program allows everyone in the company to anticipate risks and eliminate them early. Second principle is that safe and healthy work conditions are fundamental human rights. Every Filipino worker deserves to go home safe at the end of the day. Worker participation and health education are key to sustaining a culture of safety. When workers understand the risks and are involved in planning solutions, compliance improves and workplace morale increases. Occupational health covers a wide range of services. It includes health surveillance, medical examinations, and hazard assessment to monitor workers' health and detect early signs of occupational diseases. It also involves workplace environmental monitoring and accident investigation. For example, measuring noise levels or analyzing causes of workplace injuries. It also emphasizes health promotion and disease prevention programs, such as vaccination, fitness programs, stress management, and ergonomic training. This is to keep workers healthy and productive. Common hazards in the workplace includes physical hazards. This pertains to noise, vibration, radiation, heat, and poor lighting, which can cause fatigue or hearing or sensory losses over time. Chemical hazards result from exposure to toxic substances like solvents, pesticides, or industrial fumes, which can lead to respiratory or skin illnesses. Ergonomic and psychosocial hazards involve poor posture, repetitive tasks, long working hours, stress, and burnout. Nurses in occupational health settings assess and minimize these risks through education and workplace design improvements. In the Philippines, some of the most common work related illnesses include pneumoconiosis, which is caused by inhaling mineral dust like silica in mining or construction. Noise induced hearing loss, common among factory and heavy equipment workers. Repetitive strain injuries like CTS or carpal tunnel syndrome, which is common among office or assembly line workers. There are also skin and respiratory conditions from chemical exposure and mental stress or fatigue caused by overwork or lack of support. As occupational health nurses, we play a vital role in identifying early signs of these illnesses, conducting health surveillance, and promoting wellness interventions. Workplace health promotion is a proactive approach. It encourages healthy behaviors such as regular exercise, balanced nutrition, and effective stress management. Some companies now have wellness programs like Zumba Fridays or Fruit Days, to promote healthy habits. It also integrates occupational health with wellness programs and employee assistance services to address both physical and psychological well being. It also promotes smoke free, drug free, and supportive work environments. PHNs advocate for these measures, particularly when assisting LGUs or private companies with occupational health initiatives. Workplace safety is a shared effort. This is where the Health and Safety Committee comes in. These committees are composed of management, employee, and health representatives. Together, they make sure that safety policies are properly implemented. They monitor compliance with occupational safety standards and respond to emerging risks. They also conduct regular drills, inspections, and training to ensure readiness for fires, earthquakes, or medical emergencies. As nurses, we might be part of these committees, ensuring that health protocols are followed. The occupational health nurse, or the OHN, has specific functions. First is to conduct health surveillance, perform first aid and emergency care when workplace accidents or illnesses occur. OHNs provide health education, like teaching workers about ergonomics, hygiene, or stress management, and to promote safe work practices. They also participate in risk assessment, case management, and return to work planning for injured employees. This ensures that workers recover safely and resume duties without compromising their health. Public health nurses also play a big role. We assist LGUs and industries in implementing occupational health standards, especially in rural or agricultural settings. We provide outreach programs and services for informal workers like fishermen, tricycle drivers, and farmers who often lack access to occupational health programs. And most importantly, we advocate for fair labor practices and safe work environments for all sectors. On collaboration and intersectoral linkages, the DOH, DOLE, and LGUs work together to develop inspection systems and monitoring mechanisms. Partnerships with employers' associations and labor unions help ensure that workplace policies are fair and compliant. NGOs and academic institutions contribute through research and training programs that update best practices. This multi-sectoral approach helps sustain the program's reach and effectiveness. Challenges in the implementation of the occupational health program include limited resources, and occupational health professional shortage, especially in remote areas. Weak enforcement of safety standards in small and informal enterprises is also a problem, as many small businesses lack resources to comply. There is also low awareness among workers and employers about prevention, which means many still prioritize productivity over safety. This is where our health education and advocacy become critical in changing their mindsets. There are also innovations improving occupational health. This includes workplace health promotion, which is now integrated into the universal healthcare framework, making preventive care part of every worker's benefit. There is also the online reporting systems for occupational illnesses and accidents, which improve data collection and accountability. For remote or high risk areas, mobile health units bring services directly to the workers, especially in plantations, construction sites, and mining communities. These innovations highlight that occupational health is continually evolving toward inclusivity and accessibility. To wrap up, we discussed that occupational health programs safeguard workers' health and productivity. A healthy workforce means a healthy economy. Nurses are essential in promoting, monitoring, and advocating for workplace safety. Our presence ensures that preventive measures are implemented and that workers have access to health care. We know and we discuss that a culture of prevention, collaboration, and continuous education strengthens occupational well being. As future nurses, you will not only heal individuals, you help build safer, fairer, and healthier workplaces across the country.